The CHRISTUS Spohn Heart Network offers the most comprehensive cardiac care in South Texas. And now cardiac surgeons are offering their patients an incredibly precise procedure that is giving them new options.
Curtis Waters and his wife spend a lot of their time together, searching the beaches around Corpus Christi. But it was a very different kind of search that led him to CHRISTUS Spohn. He needed a bad mitral valve in his heart repaired. What he found was an innovative heart surgery at CHRISTUS Spohn Heart Network, which offers the most comprehensive cardiac, surgical, and diagnostic services in South Texas.
Our decision to do this wasn't because he had a life-threatening condition. It was maintenance, basically. You know, we've been together 39 years. We want to make it another 39 years, so let's take care of this before it gets to be a big deal.
Curtis had his valve repaired through a new innovative heart surgery. New technology is allowing doctors to perform heart surgery without having to open the chest and split the breastbone. This results in less pain and a much quicker recovery.
When you're doing minimally invasive cardiac surgery, it's like robotically assisted. You use instruments in your hand that allow you to get inside, close to the heart, without having your hands inside.
These newly designed instruments are combined with a different location where doctors access the heart through small incisions in the right side of the chest.
Instead of opening up the whole front of the chest and the sternum, spreading the chest, exposing the whole heart, what we've trimmed that down to, or minimized that down to, is a small incision, about the same incision you would get for placement of a pacemaker device.
With no need to split the breastbone, patients are back to their normal lives much quicker.
Within 2 weeks, you fully recover. You're able to drive, go back to work, or do whatever you have to do. So your recovery is much faster. Your immediate recovery as far as the heart is exactly the same, but your late recovery as far as you becoming a fully functional member of society, within 2 weeks you're feeling great and you're back to work.
While it's not for everyone, minimally invasive cardiac surgery offers many advantages for those who qualify.
So the people that are sicker are the people that benefit the most from this procedure. So yeah, cosmetically it's nice to have a small incision underneath the clavicle that is only 3 inches. You say, you know, I had heart surgery that looks exactly like a pacemaker, and ideally, I think the sicker people are the ones that actually benefit the most.
Part of the new technology is high-tech magnifying cameras, which allow the surgeons a better view of the smaller spaces they now operate within. Doctors offer minimally invasive heart surgery not only to repair mitral valves, but also for coronary bypass and aortic valve surgery. This innovative procedure results in less blood loss, less pain, and a lower risk of infection, and so hospital stays are much shorter.
Any pain I had was very well monitored. I mean, very well monitored. I did not feel the pain. I left out of intensive care a day and a half later. I was transferred out to the main hospital, and I spent 2.5 days at the main hospital, again, well taken care of. The nurses were great, and at the end of 4 days, I went home.
He came through it like a champ. He had not ever had any major surgeries to speak of, so this was a biggie.
The CHRISTUS Spohn Heart Network, bringing cardiac advancements to South Texas with the most advanced diagnostic and surgical techniques, the finest facilities, and the most dedicated medical professionals.